Welcome to Lifestyle Matters. I'm Marilyn Moore. Today we're at Fresno Surgical Hospital with Dr. Majors, who is a hand surgeon. Doctor, thanks for joining us.
Thank you for having me.
Now, the hands, that's a really cool part of the body to be working on. What is your favorite part of being a hand surgeon?
Well, it's helping people. It's getting them back to work. You have no idea how much you use your hands until you lose one or lose part of it in some injury or accident that can be either temporarily or permanently disabling. So, it's nice to help people get back to work and get back to life.
Now, what are some of the hand and wrist conditions that you treat?
Well, I treat a lot of things. Primarily, my practice is sports and arthritis. So we take care of a lot of Fresno State athletes. We take care of high school athletes, Fresno City College. We even have people coming from out of town to come see us. And then we take care of a lot of arthritis. So it's just a chronic degenerative disease that is going to affect older people. But there's a lot of other things too. Nerve entrapments, carpal tunnel, cubital tunnel, tendonitis, trigger fingers, Dequermain's disease. We take care of all kinds of fractures, reconstructive procedures of the thumb, like thumb arthritis. Yes.
I was going to say, I heard trigger thumb, and I was mentioning I get trigger thumb quite often, and I know it's because I'm either on my phone or on the computer. I mean, is this pretty, prevalent that people get? It's a prevalent condition?
It's probably going to become more and more prevalent with people doing multiple repetitive motions with their hands on their phones and video games, things like that. It's ultimately tendonitis. It's a size mismatch problem between a tendon that is too big, trying to fit through a tunnel that's too small. It usually kind of gets an area of inflammation, like a knot in it, and that tendon is trying to slide through a tunnel that it can no longer fit through very easily, and you get that pop and that click, which causes pain. And unfortunately, every time you're moving your finger, you're just irritating it more. There's lots of conservative treatments, and we can actually sometimes cure it with conservative treatment, so you don't have to have surgery. But surgery is also quite effective for triggering.
I know. I always wear a brace where your thumb's up, so it looks like I'm a hitchhiker all the time. Is this similar to thumb arthritis, or is that completely different?
Well, thumb arthritis is totally different. I mean, arthritis is, a condition that's going to develop over your lifetime. Eventually, we live on a planet with gravity. Your joints will wear out over time. And when that happens, there's now really, really pretty good treatment for it. But what does really work well is surgery.
And I want to say carpal tunnel too, just real fast. That's something that's big.
It is big. There's so many people that get carpal tunnel. Almost 10% of the population could potentially get it. And it's ultimately a compression of your median nerve at the carpal canal. And it is affected by position. So if your wrist is straight, that's a good position to be in. You're least likely to have symptoms. But when your wrist is bent this way or even back that way, you can end up getting more and more numbness in the fingers. Now, carpal tunnel, it creates a distinctive pattern of numbness in your hand. So your thumb, your index finger, your middle finger, usually the radial border of your ring finger can be affected by that. In more severe cases, you can permanently lose sensation in those fingertips, and you can actually have muscle wasting in your thumb abductor pollicis brevis muscle, which would basically make it difficult for you to abduct the thumb from the palm of your hand like that. So if you have these symptoms, the good news is it can be treated. There's conservative things that can work, but if you're having numbness and tingling that's almost constant or multiple times a day, you probably need surgery. Surgery can sometimes reverse it completely, but at the very minimum, it can at least stop it from getting worse.
Why do you love working at Fresno Surgical Hospital?
Well, Fresno Surgical Hospital is a great place to work. And for me personally, what I like about this hospital is they tailor the people that are working there to my preference and my needs. I get my own team. I know all the nurses in the preoperative holding area. I know the people in the recovery room. I know everybody in the operating room. I have a consistent team that knows how I like it and what I need. So we don't waste things that are unnecessary. People aren't getting unnecessary bills. And when you have your own team and they know exactly what you're going to be doing, the results are usually better because you're getting you're getting just the right things, the help you need.
And I think we found our surgeon, Dr. Majors, at Fresno Surgical Hospital. Doctor, thank you so much. That's all the time we have.
Oh, well, you're welcome. Thank you.
And if you want any more information, be sure to check out Fresno Surgical Hospital and look up Dr. Majors. I'm Marilyn Moore, and you're watching Lifestyle Matters.